Hello, welcome back to the secrets of what you always wanted to know and never dared to ask. In this series we talk about pelvic girdle complaints. In this fourth episode we wonder whether there can be a link between pelvic girdle complaints and the lateral curvature of the spine, the scoliosis. This time we share a concept with you for which there is not much scientific substantiation yet, but which is, from a clinical perspective, certainly worth considering. A scoliosis is the lateral curving of the spine. This deviated posture can be seen at all ages, but often scoliosis begins at a young age. It's important to identify and treat these problems early to prevent irreversible deformation of the spine. In practice, however, scoliosis appears to be a persistent and often difficult to treat problem. It starts with the notion that the cause of lateral shifting of the spine is not clear. Sometimes scoliosis may occur due to a birth defect or muscle disease. But in the vast majority of cases, about 80%, the scoliosis is idiopathic. This is a difficult word that means with unknown cause. Actually, we use an expensive term to say that we have no idea what is going on. Nevertheless, there are all kinds of treatments for scoliosis, from corsets to prevent or correct the lateral bending, to all kinds of exercises and training for strengthening of the spine. In case of severe misalignment, surgery can even be considered, in which the spine is straightened internally with steel rods and screws. Isn't it a bit weird that there are all those sometimes intense treatments, while we often have no idea what is going on? In people with pelvic girdle complaints, we often see an asymmetrical disturbance of their balance and predominant one-sided pain. It's assumed that this has to do with the disturbed control over the pelvic joints. Normally, the weight of the body is distributed equally on both sides of the pelvis. In pelvic patients, this equal distribution of body weight does not seem to be possible. As discussed in an earlier clip, pelvic complaints seem to arise from significant impact on the pelvis. What we seem to underestimate is that such impact can also occur in children. A fall from a swing, bicycle or, as here, by slipping on ice, may happen in a blink of an eye. And it remains to be seen whether children always tell if they have fallen hard in the playground, for example. Carrying your body weight with a forced pelvic joint can be painful, or at least give rise to internal pain stimuli, so-called nociception. It's to be expected that the body tries to avoid the pressure on the painful joint by shifting the body weight as much as possible to the healthy side. The way to spare the painful side and allow more body weight to be carried by the healthy pelvic joint is to actively shift the spine to the healthy side. But if you hang over too far, you may fall over. To avoid this, the spine will have to make a counter movement higher up. And see, doesn't it look like a scoliosis? This skewing of the spine is done by the body itself by more actively contracting muscles on specific places along the spine. Thus, the lateral curvature of the spine can take on different shapes due to variations in this excessive muscle tension. Although people may have scoliosis without pain, it happens that stiffness and pain occur in various, sometimes unexplained places in the body. A better understanding of the mechanism behind scoliosis, as described here, can help to explain these specific pain spots. We can test this concept in people with scoliosis. First, it has to be explored whether some forcing of the pelvis has occurred somewhere in the past. This will not always be easy with young children. In addition, the active straight leg raise test can be used to investigate whether the control of the pelvis is disturbed. If lifting a leg takes more effort than expected, this is a strong indication that the pelvis is not functioning optimally. Then, it can be tested whether manual lateral compression of the pelvis allows the pelvis to keep its spine upright better or with more ease. Of course, we do not suggest that this is the solution to the scoliosis problem, but mainly a test to see if the pelvis plays a role. If this is the case, improving control over the pelvic joints may help fight scoliosis. And we have already talked extensively about training of the pelvis in the previous clips. That brings us to the end of this clip. Maybe this concept will provide new options for the treatment of scoliosis. In the next and final clip of this series, we'll take it on one step further. Could it be that when we better understand the impact of disturbed pelvic function on common physical function, an explanation could arise for a number of until now poorly understood complaints, and that MUS, somatically unexplained symptoms, becomes MES, somatically explainable symptoms. Wouldn't that be nice? See you next time.